Okay, so let's review the case study that we've been going over in class, The Heart of the Problem. So this is a story about Mr. Helms. And what happens to Mr. Helms is he had a heart attack. So he had a heart attack, the paramedics transported him to the hospital, and these are the vital signs we got. So let's just go through the vital signs and find out which one of these were abnormal. What about blood pressure? His blood pressure's low. What about heart rate? His heart rate's high. And not only that, but it's irregular. It's not beating in a regular pattern. What about respiratory rate? Respiratory rate is high. And he's also working really hard to breathe. Okay, his breathing is labored. And what about oxygen saturation? That's low. The amount of oxygen attached to the hemoglobin in the blood is lower than it should be. Okay, let's go down to part 3, cardiovascular involvement. So Dr. Collins called Nurse Nan from the patient's room and confided, Mr. Helms is in bad shape. His left posteromedial papillary muscle was damaged from his heart attack. His left posteromedial papillary muscle was damaged from his heart attack. So let's go back up here. So we just found out that a papillary muscle in Mr. Helms' left ventricle was damaged. And if the papillary muscle was in the left ventricle, then which valve is going to be affected by that? That's the mitral valve. The atrioventricular valve that separates the atria and ventricles on the left side of the heart. Okay. The papillary muscle is no longer able to maintain closure of the valve, and this has resulted in mitral valve prolapse. With decreasing cardiac output, this patient is in for the fight of his life. All right, so in general, how is the direction of blood flow disrupted because of mitral valve prolapse? Let's draw a little diagram here. And we're going to have this be the mitral valve. Now, normally what happens when the ventricles contract is that blood moves out of the left ventricle and shoots into the aorta. So that's what happens normally. And the reason that can happen is because when the left ventricle contracts, the mitral valve provides a nice seal between the atria and the ventricles. But now with this prolapse, what's happening is that mitral valve is moving back up into the left atrium there. So how is blood flow disrupted because of this mitral valve prolapse? Well, now when the ventricles contract, not all of that blood is going from the left ventricle into the aorta because some of it is now going into the left atrium. So we have a backflow of blood from the left ventricle to the left atrium. So what is this backflow of blood due to stroke volume? What is this mitral valve prolapse due to stroke volume? And what is stroke volume? In the case of the left side of the heart, stroke volume is the amount of blood moving from the left ventricle into the aorta. So what's happening to stroke volume with this prolapse? It's going down. Stroke volume is going down because some of that blood is now going into the left atrium. How does mitral valve prolapse change cardiac output? Well, what's the equation for cardiac output? Cardiac output is heart rate times stroke volume. And if stroke volume is going down, then what's that going to do to cardiac output? Cardiac output is going to go down. Okay. And if cardiac output goes down, what does that do to blood pressure? If you have less blood moving from the heart into the arteries, what's that going to do to the blood pressure in the arteries? You're going to get a decrease in blood pressure, okay, because you don't have as much blood moving from the heart into those arteries. Less volume of blood means less pressure on the walls of the artery, which means lower blood pressure. So let's skip down to this one here. Why is Mr. Helms' heart rate higher than normal? Well, what is he trying to do to try to get that cardiac output back up? He's increasing his heart rate. So that increase in heart rate is his body's response to try to get that cardiac output back up to where it needs to be. Okay, let's move on to part 4, pulmonary involvement. Miss Helms was very upset with the news of her husband's condition. As the day progressed, she noticed that Mr. Helms' breathing was increasingly difficult. He could barely speak without losing his breath. Miss Helms called the nurse to her husband's room. "My husband can't breathe. What's wrong? I thought he had a heart attack, not a respiratory condition." So Nurse Nan auscultated or listened to the patient's chest during his respirations, and what did she find? 1, they were rapid, and 2, they were wet sounding. They were producing rales or crackling when he was breathing. So Nurse Nan calmly informed Ms. Helms, "I'm sorry, your husband's condition is worsening. The damage to his heart is causing his respiratory problems." Okay. So let's go to question number 2 here. If the bicuspid valve is not fully closing, what does that do to pulmonary circulation? Well, let's look at this figure here to deal with that. So here we have the pulmonary circuit up here, and we want to know what this mitral valve prolapse is doing to pulmonary circulation, the amount of blood that's traveling through the lungs. So what is this mitral valve prolapse doing to the amount of blood that's traveling through the lungs? It's decreasing it. It's decreasing pulmonary circulation. And why is that the case? Well, normally that blood goes from the left ventricle up into the aorta, but now we're having some of that blood go up into the left atrium. It's not a very good color. Some of that blood is going up into the left atrium, and so that blood is pooling up in the left atrium, and that causes the blood to pool up in the pulmonary circulation. Okay, you're basically kind of providing a dam right here. Okay, you're increasing blood pressure in this side of the capillaries because blood is backing up there. And what is that doing? It's preventing blood from moving freely through the pulmonary circulation. Okay, so you have a decrease in pulmonary circulation. We're decreasing pulmonary circulation. What about pulmonary blood pressure? What happens to the blood pressure in the pulmonary circulation with this mitral valve prolapse, with this left-sided heart failure? Well, pulmonary blood pressure is going up as well. And again, what's happening here, the reason that's the case, is because we have this blood backing up into the pulmonary circulation. So now there's more blood in the pulmonary circulation and the pulmonary capillaries. So you increase blood pressure of the pulmonary circulation. Okay, we're increasing pulmonary blood pressure. Does this change in pulmonary blood pressure, what does that do to capillary filtration? What does capillary filtration even mean? Well, I'm just going to tell you right now that it increases capillary filtration. An increase in blood pressure in the pulmonary capillaries leads to an increase in capillary filtration. Let's see here. So this is the respiratory membrane here, and capillary filtration is referring to the movement of materials from the capillaries into the alveoli. And if you increase the pressure in these capillaries here, then what that's going to do, what that's going to do is it's going to cause fluid to move from the capillaries into the alveoli here. And that's what that capillary filtration is referring to. You have an increase in fluid that's moving from the capillaries into the alveoli, and it leads to a collection there. It leads to fluid in the alveoli. So how does this increase in capillary filtration cause Mr. Helms' rales, his wet breath sounds? Well, we just went through that. You have that increased pressure is causing increased fluid in the lungs, and so when he breathes, that fluid is causing that crackling sound. Now, why is Mr. Helms breathing rapidly? We have this fluid in the lungs, and we want to know how that's related to him breathing rapidly. And I guess the best way to think about this is if you have fluid in the alveoli, then what's that going to do to gas exchange if you had to guess? It's going to disrupt gas exchange. So we're decreasing gas exchange, and so not only are we not getting enough oxygen in the blood, which explains his low O2 saturation, but most likely he has high levels of CO2 in the blood as well. And so he's breathing rapidly to get rid of the CO2 and also to increase the oxygen. Okay, part 5, renal involvement. The next morning when Nurse Nan started her shift, she immediately checked on Mr. Helms. His cardiovascular and respiratory conditions were still deteriorating, but Nurse Nan discovered something new. Mr. Helms' urine output was almost non-existent. Nurse Nan informed Dr. Collins. Dr. Collins met with Ms. Helms to tell her that her husband could not survive kidney failure. Okay, so let's go through these questions here. First of all, what are the functions of the kidneys? What are the functions of the kidneys? Functions of the kidneys are to maintain blood chemistry. What is the force that causes the filtration of blood by the capillaries into the kidneys called? We didn't go over that, but that is glomerular pressure. Okay. And does left-sided heart failure increase, decrease, or not affect kidney filtration? So basically, what is this doing to the kidneys? So to think of this, actually, okay. Now we want to know how this mitral valve prolapse here is affecting the kidneys. And the kidneys are part of the systemic circuit here. So you have two renal arteries that come off, and those both go to the kidneys. Okay, these are the renal arteries. And basically what's happening is this mitral valve prolapse are causing his kidneys to fail. So what's the connection for that? Well, what do you think's happening? What did we say is happening to his systemic blood pressure? He has low systemic blood pressure, and that's because, like we said, not all of that blood is going into the aorta, so his blood pressure went down. So how does that cause kidney failure? Well, here's the afferent arteriole, and basically what this is showing is this is the glomerulus here, this is the glomerular capsule, and this is just showing all of the different pressures that are going on here that cause the formation of filtrate. So we have fluid leaking out of there and forming filtrate. The reason that's happening is because we have 10 millimeters more pressure in these capillaries than in the glomerular capsule here. So just 10 millimeters of positive pressure allows that fluid to leave the capillaries and form filtrate. Okay. So why is this causing kidney failure? Well, what's happening, so the pressure inside the capillaries here is the glomerular pressure, and that's 55 millimeters of mercury incoming here. So what's going to happen to that glomerular pressure if we have low systemic blood pressure? That's going to lower that pressure. Okay, and if the pressure here is lowered, then that decreases this net pressure. Okay, it may go down to 2 millimeters of mercury. So we have a little bit of filtrate forming, but not a whole lot of filtrate. Okay, and essentially what that's doing is it's causing kidney failure. Okay, because we don't have enough filtrate that's going through there. And so there's not filtrate going through the kidneys, which is why his urine output is low, because there's really little to no filtrate formation. So does left-sided heart failure, what does that do to kidney filtration? It decreases kidney filtration. And why is kidney failure a problem? Because you're unable to maintain blood chemistry. Not able to do it. Because to do that, you have to form filtrate and only return the necessary substances to the blood. If you don't form filtrate, then you're not going to be able to maintain blood chemistry. Okay, part 6 resolution. Basically, he goes in for valve replacement. And what do they say? He's going to be just fine. So a good outcome. And basically, what happens? Well, with a normal valve, stuff is just able to go back to normal. So I don't necessarily want to spend time going through those there, but I do want to take this moment now and list some of the symptoms that Mr. Helms had with left-sided heart failure, and then we can compare that to right-sided heart failure. So what are some symptoms that Mr. Helms had? Low blood pressure, high heart rate, high respiratory rate, wet breathing, and low urine output. Okay. So these are all left-sided heart failure right here. Now, what about right-sided heart failure? Let's go back to this diagram here. We'll color should I use? See if yellow turns out. So now we have right-sided heart failure. And let's say that this right-sided heart failure was due to damage to the tricuspid valve. Okay, so the right AV valve. So normally what happens is blood moves from the right ventricle into the pulmonary circulation. But now, because of this mitral valve prolapse, just like on the left side of the heart, we're going to have a backflow of blood. That blood is going to backflow into the right atrium here. And so what does that do if you have a backflow of blood into the right atrium? Well, it backs up into the systemic circulation the same way that it did on the left side up here into the lungs. And so it backs up into the systemic circulation. And if you have an increase in the blood pressure of these capillaries down there, what effect is that going to cause? It's going to increase capillary filtration down there. It's going to increase the amount of fluid leaving the capillaries for the systemic tissues. And what is that going to cause? It's going to cause edema or swelling because, again, the capillary filtration is going up. There's too much fluid moving from the capillaries back into the tissues. So edema is one of those. What's something else that would happen here? What would happen to, let's see. Give me 1 second here. Okay, so what would this situation do to the pulmonary circulation? The amount of blood going through the lungs. Pulmonary circulation is going to go down. And if pulmonary circulation goes down, what does that do to gas exchange? You have a decreased gas exchange, which probably means you're going to have low oxygen and high CO2. And how's the body going to try to correct for that? You're going to increase your respiratory rate. So with right-sided heart failure, we're going to have edema. We're going to have increased respiratory rate. So let's see, we have edema. We're going to have increased respiratory rate up here. Let's see, that decreases cardiac output into the pulmonary circulation. So, and we'll just go through this here. But if you have, can't zoom that in. If you have a decrease in pulmonary circulation, then you're going to have a decrease of blood going back to the left side. So you're going to decrease blood here, which means you're going to decrease cardiac output there. Okay, so cardiac output's going to go down. So if cardiac output goes down, then heart rate's going to go up to try to compensate for that. So you're going to have an increased heart rate as well. And again, if you have decreased cardiac output, then you'll probably have low urine output as well.